Hi, my name is Diana, and I'll be your nurse for today. Today, I'll be teaching you about compression stockings. Today, you will learn the benefits of wearing compression stockings, how to appropriately measure your leg to find the correct size of compression stockings, and how to apply compression stockings. But before we begin, it's important to understand what compression stockings are and that compression stockings come in different lengths and sizes. Compression stockings are socks that apply tight pressure on your legs, and they can either come in thigh-high or knee-high length. For today's session, we'll be focusing on knee-high compression stockings. Outcome number 1. By the end of this session, the patient will be able to verbalize 3 benefits of wearing compression stockings. Outcome number 2. The patient will be able to demonstrate how to accurately measure their leg with a tape measure to find the correct size of compression stockings. Outcome number 3. The patient will be able to demonstrate how to apply compression stockings using the recommended application method. Let's begin by learning about the benefits of wearing compression stockings. Number 1. Compression stockings help increase the blood flow and circulation of fluid throughout the legs due to the compression from the sock. This ensures that normal blood flow is going towards the heart and not backflowing into the legs. Number 2. Compression stockings help decrease the swelling in your legs and ankles, due again from the increase of blood flow and the circulation of fluid. With the increase of circulation of fluid, it doesn't allow fluid to sit outside of the blood vessels, which cause the swelling. And number 3, compression stockings help prevent blood clots due to the compression from the sock increases the blood flow. If blood clots were to be left untreated, they can lead to deep vein thrombosis, which are blood clots that develop deep within a vein and most commonly occur in the legs. Next, I'll be teaching you how to accurately measure your leg using a tape measure to find the correct size of compression stockings. You want to begin by getting your tape measure. I'm using here just a simple paper tape measure. You want to make sure it's in centimeters. And you're going to want to begin by measuring the circumference just above the ankle bone and making sure to record the length. Next, you're going to want to measure the circumference of the widest part of your calf and making sure to record the length. And then you're going to want to measure above the ankle bone and below the knee and record the length. And then finally, you're going to want to gather your measurements and compare them to a sizing chart to identify the correct size of compression stockings for you. And finally, I'll be teaching you how to apply compression stockings using the recommended application method. You want to begin by removing the stockings from their package, unfolding them, and then finding the top of the stocking, which is usually the widest part, and then the bottom of the stocking, which is usually where your toes go. Next, you're going to want to slide your hand down the sock and find the heel. As you can see here, this one has a square. You want to make sure that that heel or that square is in the palm or the middle of your hand. And then you're going to want to pinch and hold the heel and then slide the stocking away from you, turning it inside out. And then you're going to want to stretch and roll the sock down. Finally, I'll be demonstrating how to apply the compression stockings. So you'll find the top, the bottom, and the heel portion of the compression stockings. You're going to slide your hand down. You're going to find the heel and place the heel on the palm of your hand. And then you're going to pinch and you're going to hold. And you're going to pull the stocking away from you, turning it inside out. Making sure that the heel portion is facing down, you're going to stretch and roll the stocking as much as possible, and you're going to slide it over the top of the foot and down the heel. Making sure that that portion is covering the heel before pulling it down the leg. Next, you're going to roll the remainder part of the stocking. And you're going to slide it up the leg. You want to make sure there are no twists or wrinkles and that the heel portion is over the heel and making sure they fit snug and not too tight. To evaluate outcome number 1, the patient will be asked to verbalize 3 benefits of wearing compression stockings, which are: compression stockings help increase blood flow and circulation, they decrease swelling in the legs and ankles, and prevent blood clots such as DVTs. To evaluate outcome number 2, the patient will do a return demonstration of how to accurately measure the leg using a tape measure by measuring in centimeters the circumference above the ankle bone, the circumference of the widest part of the calf, and the length between above the ankle bone and below the knee. Then compare their measurements to the appropriate sizing chart to identify the correct size of compression stockings they will need. To evaluate outcome number 3, the patient will do a return demonstration of how to apply compression stockings by finding the top, the heel, and the bottom of the compression stockings, sliding their hand down to the heel of the compression stockings, pinching, holding, and pulling the stocking away from them, turning it inside out. Then sliding the stocking over the top of the foot, down the heel, and over the leg. And lastly, ensuring that there are no twists or wrinkles at the end of the application. Here are my references, and this concludes my teaching video on compression stockings. Thank you for listening.